Hello guys. Dr. Kevin here. Today we're going to discuss about cough and its medicine. There are several over-the-counter medicines that can help relieve cough symptoms. However, it's important to note that the choice of medication depends on the type and cause of the cough. Here are some common types of cough medicine. Cough suppressants. These medications help reduce the urge to cough. They are generally recommended for dry, non-productive coughs that do not produce phlegm, that is mucus. The active ingredient in many cough suppressants is dextromethorphan. Expectorants. These medicines are used for productive coughs that produce phlegm or mucus. They work by thinning and loosening the mucus, making it easier to cough up. Guaifenesin is a commonly used expectorant. Combination cough medicines. Some cough medicines contain a combination of ingredients to target different symptoms. They may include a cough suppressant, an expectorant, and/or a decongestant. These are often marketed as multi-symptom or cough and cold medicines. Cough drops or lozenges. These are not medications but can provide temporary relief by soothing the throat and suppressing the urge to cough. They often contain ingredients like menthol, eucalyptus oil, or honey. Additionally, if your cough persists for more than a few days, is accompanied by severe symptoms, or is causing significant discomfort, it's advisable to seek medical attention to determine the underlying cause of the cough and receive appropriate treatment. Most commonly, a combination medicine is used in the treatment of cough with mucus, that is levosalbutamol sulfate plus ambroxol plus guaifenesin. For the treatment of cough without mucus, that is dry cough, we prescribe dextromethorphan hydrobromide plus chlorpheniramine maleate plus phenylephrine hydrochloride.